Okay. So I know we really want to talk about how PCOS affects different areas. So one being fertility. I know a lot of people, especially in our Facebook group, talk about having PCOS and having a lot of difficulty with getting pregnant. So how does PCOS affect fertility in general?
Well, PCOS causes irregular menstrual cycles. So usually, in a normal cycle, you usually ovulate somewhere in the middle. The textbooks say day 14, but that will vary person by person. And then after that, about 2 weeks later, you would see a period or you'd be pregnant. And that textbook version of a menstrual cycle looks very different sometimes with PCOS. A lot of times the hormone levels are off enough that your body tries to ovulate but doesn't quite get there. And then a couple days later, it might try again and doesn't quite get there and tries again and tries again. And
Mm,
that process makes really long cycles that are anovulatory. So you don't actually ovulate even if your body's trying to. And so those are the two main things with PCOS is these long cycles without ovulation, or heavy periods can also be something that people experience. I definitely experienced the really long cycles. There were some times that I went a full 100 days between periods.
oh,
So
wow.
very unusual. That's not a normal menstrual cycle. So if your body is trying that long in one cycle to ovulate once and it's not happening, that's 100 days of no ovulation. You can't get pregnant without ovulation. So it's
Mhm.
not like, okay, well, we'll just try next month. It may take 3 months to have one chance. And so that
Mhm.
has to do with a lot of the complications with trying to get pregnant because you have fewer chances. And then when you do, it's not on day 14. What if it's on day 47? How do you
Right.
figure out which day that is? And so that's why fertility can usually be the main driving factor for women to go talk to their doctor if they're having trouble, and something like PCOS could be the underlying issue.